Good evening, everybody. In previous classes, we have discussed about basic concepts about oncology and specific genes that are responsible for causing oncology, their pathogenesis, risk factors of certain cancer conditions, and we have started with pharmacology. And in pharmacology, we have discussed about alkylating agents, and after that, we started with leukemias. Okay, in leukemias, we have covered myeloid leukemias. In that, we have acute myeloid leukemia and chronic myeloid leukemia. And then we discussed about lymph, uh, lymphomas also. I mean, in lymphoid leukemias, in that acute lymphoid leukemia and chronic lymphocytic leukemias, we have discussed. And in leukemias, we have lymphomas. Okay, those lymphomas will be discussed very soon. Okay, after finishing today, I'll try to discuss these lymphomas. In this, we have Hodgkin's lymphomas and non-Hodgkin's lymphomas, which are very, very important concepts that we will discuss. See, actually, I thought to cover that topic today only, but before that, we should try to understand about certain anti-cancer drugs. That's why I just postponed. Next class, we will discuss about lymphomas. So, in our 30 days course of 1 month course of basics of medical oncology and chemotherapy, today is the ninth day. So, in today's class, we'll try to discuss about certain anti-neoplastic drugs, which are particularly Vinca alkaloids. Actually, from today, we will discuss about natural compounds or natural drugs, natural anti-cancer drugs. Okay, natural anti-cancer drugs. In that, most important natural anti-cancer drug is Vinca alkaloids. Vinca alkaloids. So these Vinca alkaloids are very famous, particularly for pediatric patients and in leukemias. So when we discussed about multiple myelomas in that concept, I think already I gave some basic concepts about Vinca alkaloids. But in today's topic, we will cover everything about Vinca alkaloids, its pharmacology and all. Okay. So let's begin our session with Vinca alkaloids. In today's class, we'll discuss about the drug information and pharmacology of these natural compounds, which is Vinca alkaloids. See, Vinca alkaloids are the class of microtubule damaging agents. These are called microtubule damaging agents, or simply Vinca alkaloids are microtubule microtubule inhibiting agents or inhibitors, microtubule inhibitors. So when microtubules are inhibited, what happens? When these microtubules are inhibited, it will inhibit the cell synthesis or cell division. It will inhibit the cell division. As these Vinca alkaloids are microtubule damaging agents, they are microtubule inhibiting agents. They are inhibiting the cell division. That's why these drugs will come under cell cycle specific drugs. Okay, they will act on cell cycle specific. That's why they are called cell cycle specific anti-cancer drugs, because they are acting on the cell cycle. Okay. Now you see, we understood that Vinca alkaloids are inhibitors of microtubules. Now, what are microtubules? What are microtubules? Microtubules क्या है? Can anyone tell me what are microtubules? What is the importance of microtubules? Okay, let me explain you. See, actually, one important point you have to remember: microtubules. Microtubules are very very important proteins. These are proteins. These are proteins. Microtubules are important in cell division. Just now we understood. Okay, they are important in cell division. Actually, in cell division, we have many stages and many steps. Particularly in mitosis. In mitosis, in metaphase, particularly in metaphase, these microtubules are very important. So that we'll try to understand. So microtubules are important in cell division. That point already we know. Okay. See, to understand about these microtubules, let me try to explain you about the basic physiology and basic morphology of the cell. See, everybody knows that cell is made up of cell membrane, and in the cell we have nucleus. Nucleus is containing chromatins or DNA, RNA molecules, and along with that we have all other cell organelles, like we have mitochondria, which is the powerhouse of the cell. We have Golgi apparatus, we have ribosomes. Okay, all other cell organelles we already know. Okay, among all these cell organelles, there is one cell organelle which is called cytoskeleton. Okay, there are certain compounds or protein molecules. They are called cytoskeletons. Okay, what these cytoskeletons does, these cytoskeletons will try to shape the cell. they will help for the morphology. I mean, they will shape or they will give certain structure for the cell. Okay, shape and structure will be given by this cytoskeletons. They will help in contraction. They will help in contraction of the cell, and these cytoskeletons will help for the movement of the cell. For the movement also, they are very important in movement of the cell. For example, we in the blood we have some blood cells. Okay, RBC, WBC, and all macrophages and all. Those blood cells are moving from one place to another. So for that movement, these cytoskeletons are very important. And along with that, these cytoskeletons are very very important in cell division. Cell division. So cytoskeletons are very important in the cell for giving shape, for making or for performing contraction of the cell, for movement, and also for cell division. This is very important. So these are certain functions of cytoskeleton. Okay. Now the cytoskeleton are proteinaceous compounds, and these cytoskeletons are made up of three main compounds. In that first main compound by which cytoskeleton is formed is we have actin filaments. Actin filaments. We have actin filaments. Along with that, we have intermediate filaments. Intermediate filaments. Second one. And third, very important component of cytoskeleton is microtubules. Microtubules. So microtubules are very very important component of cytoskeleton, right? So I told the cytoskeletons are important in giving shape to the cell. They are important in contraction of the cell. Contraction of the cell. They are important in movement of the cell, and they are also very important in cell division. So in cell division, actually, these microtubules are very very important in cell division. Now you see, these cytoskeletons are made up of actin filaments, they are made up of intermediate filaments, and very important third component is microtubules. So microtubules are important components of this cytoskeleton. Now, these microtubules are particularly made up of certain proteins which are called alpha and beta uh, uh, tubulins. As we have alpha tubulin and beta tubulins. We have tubulin. These are alpha and beta tubulin. See, alpha tubulin, beta tubulin, alpha tubulin, beta tubulin, alpha. These are simultaneous alpha and beta tubulin. This alpha and beta tubulin is conjugated. It is attached with one another, and it will form a long chain. Alpha beta globulins will form a long chain, and this type of long chains are combined with up to 11 to 13 different filaments. Okay, and this 11 to 13 filaments of this alpha beta tubulins is called microtubule. So simple. Microtubule is the component of cytoskeleton, and these microtubules are made up of alpha and beta tubulins. Alpha and beta tubulins are the basic building blocks of microtubule. Simple point. Alpha and beta tubulins are basic building blocks of microtubule. So microtubules are the main component of cytoskeleton, which is helpful for cell division. Now you see, Vinca alkaloids are the drugs. If you see the mechanism of action of Vinca alkaloids, I'm trying to explain you the mechanism of action of Vinca alkaloids. Vinca alkaloids. Their examples and all we'll discuss in the next slides. First, let's understand the mechanism of action. Vinca alkaloids. So mechanism of action is what Vinca alkaloids does. Vinca alkaloids will go and bind on the beta tubulin of the micro tubule, and with this it will stop the formation of microtubule. Microtubule is the combination of alpha and beta tubulins, right? Alpha and beta tubulins. So Vinca alkaloids, what they do, they will stop or they will inhibit the formation of microtubule. And when this microtubule formation is inhibited, these microtubules will stop the formation of cytoskeleton, and this cytoskeleton will actually, the cytoskeletons are very very important in cell division. Cell division. So in the absence of microtubules, what will happen? Cell division will be stopped. There is no cell division, and due to decreased cell division, what happens? The neoplastic cells will not perform cell division, and we can stop the proliferation of neoplastic cells. Neoplastic cells. So this is the mechanism of Vinca alkaloids. Simple point. Vinca alkaloids will stop the formation of microtubules because microtubules are important in cell division. So when microtubules are not synthesized, obviously it will stop the formation of new neoplastic cells. And one more thing you should ask, see, microtubules are not only important in the cell division of neoplastic cells, these microtubules are also important in cell division of normal cells. So in our body, normal cells also will be performing cell division. So in our body, we have some epithelial tissues, germinal tissues, skin tissues. In the GI tract, we have epithelial tissues. Okay, all these continuously developing cells in this mitosis also, in this cell division also, these Vinca alkaloids will show impact. As these normal cells are not continuously developing, they will be developing only in certain periods. Only periodic cell division can be seen in normal cells, but in neoplastic cells what happens? Neoplastic cells will be continuously dividing in the body. That's why Vinca alkaloids are particularly, they will stop the division of neoplastic cells. Anyways, I think you all understood the mechanism of Vinca alkaloids. Simple, Vinca alkaloids will stop the formation of microtubules, which are important in cell division. Okay. See, to make you understand, see, actually, this is the process of cell division in mitosis. If you see, initially, DNA will be replicated. DNA will replicate into the daughter DNAs, and again, it will start mitosis. In mitosis, what happens? These are the microtubules. These thread-like substances are microtubules. These thread-like substances, microtubules, what they will do? They will contract the daughter chromatin molecules. Anyways, to make you understand, see, I think this is better. Okay. In metaphase, they are particularly Vinca alkaloids. Vinca alkaloids are particularly active at metaphase. At this phase, they are very active. See, in mitosis, we have four major steps. In mitosis, we have four different stages. In first stage, which is a prophase, in first stage, what will happen? All the chromosomes of the cell will be condensed at particular point. At particular point, all the DNA molecules, the chromatins will condense. Condensation bolte condense, they will condense here at prophase, and after condensation what happens, the prophase will go to metaphase. In metaphase, all the chromatin molecules, the chromatins will go and they will come at one single line in the middle of the cell. Okay, chromosomes will come in one single line, and when they come at one single line, what happens? Here we have centrosomes, okay, or centrioles we call. Okay, actin filaments. From here, actin filaments will be sent to the this chromatin molecules, and from both the sides they will send these microfilaments. These microfilaments are made up of microtubules. These microtubules are important in contracting. See, in metaphase, after metaphase, what happens? In anaphase, the daughter chromatins are contracted at the particular direction, in this direction. They are contracting in this direction, or they are after forming the daughter chromatins, they are what we can say, they are bringing to this particular direction, and this contraction or this movement of these sister chromatins are particularly performed by microtubules. These thread like substances are microtubules, which are obtained from the centriole. From the centriole they are obtained. So what they are doing, they are contracting the daughter chromatins. So the for the contraction or for the movement of these daughter chromatins, microtubules are important. So these microtubules, what they are doing, they are differentiating, or they are dividing the daughter chromatins into two. And when they are divided, what will happen? Again, these chromatins will go to two different places, and they will again form a boundary on their chromatin molecule, on the DNA molecule, and that phase is called telophase. And these four stages are very important in mitosis. And to perform these stages, to perform these steps, microtubules are playing very important role. Okay, to divide these daughter chromatins, microtubules are contracting. See, microtubules are contracting to the one direction of the cell. That's why microtubules are important, and these microtubules are, their synthesis is stopped by Vinca alkaloids. So what Vinca alkaloids are doing? Vinca alkaloids are stopping their formation. Microtubule formation is decreased. When microtubule formation decreases, what will happen? This step metaphase will not be performed, and anaphase will not be performed, and through that cell division will be stopped. I think you all understood the mechanism of Vinca alkaloids. Okay, you can just see the mitosis of the cell. See, this is the, just for understanding purpose, you can see how single cell is dividing into two different cells. Okay, here actually at particular point, it is, see, microtubules, what they are doing? Microtubules, see, microtubules are dividing the two cells, two daughter cells, here and here, two daughter cells, it is dividing. Anyways, chalo, I think you understood what I'm trying to tell. Clear, everybody? Are you all following me? You all understood the mechanism of Vinca alkaloids? Clear? Yes. Now you see. Now this concept is little bit advanced concept. Vinca alkaloids. Vinca alkaloids will have resistance. How many of you know this concept? Vinca alkaloids will have resistance. Anybody? How many of you know that Vinca alkaloids will have resistance? Now I'll try to explain you in detail how Vinca alkaloids will cause resistance. Same like antibiotics. See, in antibiotics, we have certain antibiotics which will act on the DNA molecule for the protein synthesis. Okay, and we have certain antibiotics which will act on metabolic reactions where protein synthesis is stopped. And certain antibiotics, what they'll do, they will stop the formation of cell membrane. Okay, cell wall synthesis inhibitors. So all these antibiotics, what happen, they have resistance. They will show resistance. Why? Because the bacterial cell wall or bacterial protein synthesis, they will try to adapt the new methods. When protein synthesis method is adopted by the bacteria, what will happen, that particular antibiotic will show resistance. In the same way, antineoplastic drugs like Vinca alkaloids also will have resistance. They will also show resistance. And in that, to show resistance, Vinca alkaloids, they are having three different process, three different steps. In that first step of resistance, sometimes what will happen, Vinca alkaloids will show cross resistance. Cross resistance. So for example, in Vinca alkaloids, we have vincristin, and vinblastin. If vincristin is continuously used for the patient, and when vincristin shows resistance to that particular neoplasm, and again vinblastin is again initiated to that particular patient, so what will happen, vinblastin and vincristin both are having same mechanism of action. Due to their same mechanism of action, same binding site on the beta globulin of the tubule, what will happen, vinblastin also shows resistance. That particular concept is called cross resistance. So different drugs showing same mechanism will have more probability of causing cross resistance. So vincristin and vinblastin both may have cross resistance. This is one mechanism of showing resistance. And number two, very very important concept, overexpression of overexpression of uh, P glycoprotein. There is one protein called P glycoprotein. This is very very important. In competitive exam also this comes. Everybody should try to concentrate here. There is one protein called P glycoprotein. This P glycoprotein is also called as MDR1, multi-drug resistant 1. It is also called as ABCB1. Okay, and it is also called, its other name is CD243. Okay, CD243. These are different names of this particular protein, which is called P glycoprotein. Actually, see, we have certain cells in our body. Okay, our total body is made up of cells. On our cell membrane, we have certain proteins or certain channels. In those channels, Pgp is one protein which is associated with the efflux channel. Actually, this is the efflux channel. Whenever certain drugs are given to the body, when drug tries to enter into the cell to show its pharmacological action, what this Pgp molecule does, Pgp molecule will try to eject out these drugs. So whenever these Pgp molecules, these are efflux proteins or efflux channels, whenever these Pgp molecules are overexpressed on the cells, what will happen? They will have high probability to eject this drug out. They will have high probability to eject this drug out. Whenever a patient or a cell is overexpressed with Pgp or with MDR1 or with ABCB1 or with CD243, that particular cells will will easily efflux the drug from the cell, and by that the particular cell will not show action. And due to this, what will happen, patient will have resistance. Resistance is shown to the patient when patient is having overexpression of P glycoprotein. So P glycoproteins are effluxer molecules which are expressed on certain tissues. You have to remember that Pgp molecules are highly expressed in our body. They are highly expressed in GI tract, particularly in ileum, colon, and rectal. On this large intestine, particularly on the large intestines, these Pgp molecules are overexpressed. They are also expressed in liver. In liver also they are highly expressed. Okay, so these are very very important organs on which these Pgp molecules are overexpressed. Along with that, they are also expressed in kidneys. Okay, in kidneys also these molecules are expressed. So if a patient is expressed with Pgp molecules or MDR1 molecules or ABCB molecule or CD24 molecules, those particular patients are having high probability to eject the drug out of the cell, and with that it will show drug resistance. So this is second mechanism of Vinca alkaloids which will show resistance. When Vinca alkaloids are given to the patient who is expressed with P glycoprotein, when Vinca alkaloids are administered to the patient who is having Pgp expression, so in that patients definitely Vinca alkaloids will have resistance. So what will happen? See, there are certain patients who are already expressed, there are certain patients who are already expressed with PGP. Patients are already expressed with PGP. What will you do? Patients are already expressed with PGP. What will you do? And in that patients, Vinca alkaloids or drug of choice. Vinca alkaloids are compulsory. Vinca alkaloids should be suggested. So in that case, what will you do? In that case, what will you do? Anybody from the class? Patient is expressed with PGP, P glycoprotein, and in that already Vinca alkaloid should be the drug of choice. Vinca alkaloids देना ही है. So in that case, what will you do? Anybody from the class? Anybody from the class? See, Vinca alkaloids are having resistance ability. Why they'll show resistance? Because Vinca alkaloids will be easily ejected out from the cell when Vinca alkaloids are given to stop the proliferation of neoplastic cells. When Vinca alkaloids are given, Vinca alkaloids are toxic. Okay, what our body does? Our body tries to excrete that particular Vinca alkaloids from the body because our body is having overexpression of PGP. PGP molecules are efflux molecules. These PGP molecules, what they will do? They will try to remove the drug from the body. They will try to remove the drug from the body. If a patient is already overexpressed with PGP, okay, and this patient is required with Vinca alkaloid, which is having resistance. So in this case, what will you do? Any answer from anybody? In these cases, what we have to do? We have certain drugs. We have certain drugs which will inhibit PGP. They are PGP inhibitors. There are certain drugs which will inhibit PGP. Along with PGP inhibitors, if we give Vinca alkaloids, will Vinca alkaloids show action? Vinca alkaloids will show action or not? Yes, Vinca alkaloids will show their beneficiary actions. That's why if anybody has PGP overexpression, in that cases, we will try to give certain drugs. I don't remember the examples of PGP molecules, PGP inhibitors. Along with Vinca alkaloids, PGP inhibitors are suggested. If patient is overexpressed with PGP molecules. Clear? That answer I was expecting, but I didn't receive. Anyways, so we understood the two methods of drug resistance. There is third method of drug resistance. If a patient has, if a patient has we have beta tubulin and alpha tubulin, right? Alpha tubulin, beta tubulin, alpha tubulin, and beta tubulin. All these tubulins are helping to form a microtubule. Microtubule. Okay. Vinca alkaloids are coming and binding on this beta tubule, and through that it is stopping the association of alpha and beta tubules, and by that it is stopping the production of microtubule. It is stopping the production of microtubule. If 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 a body is having, or if a patient is having, if a cell is having mutation on the beta tubulin, if beta tubulin is having mutation, and if this beta tubulin doesn't receive Vinca alkaloid on its structure, what will happen? It will not receive on the beta tubulin, and with that Vinca alkaloids will not show its pharmacological action. So this is the third step of drug resistance of Vinca alkaloids. In certain cases, beta tubulin will have resistance, and with that patient will have beta tubulin will have mutation, and with that Vinca alkaloids will have resistance. I think you all understood the three steps, three methods of resistance of Vinca alkaloids. So far, what we understood the mechanism of action of Vinca alkaloids. We have understood the resistance of Vinca alkaloids. Now let us try to understand the examples of Vinca alkaloids. In Vinca alkaloids, we have vinblastine, vincristin, vinorelbine. Okay, these three are Vinca alkaloids. These three are Vinca alkaloids. This is the another compound which is not associated, which is not related to Vinca alkaloids. Okay, so eribulin is another compound which is different, but mechanism is very similar to Vinca alkaloids. So Vinca alkaloids, if you see, Vinca alkaloids is available in IV form. Okay, and vincristin, vinblastine, all these compounds are available in IV form. Vinorelbine is also available in IV form, and these are very commonly used in IV infusion. They are not given in IM, and they are not given in subcutaneous. If they are given in subcutaneous route, they will cause severe rashes. That's why they are never given in subcutaneous or IM route. So they are particularly injected only in IV infusion. Okay, they are given in IV infusion, either in bolus or in slow infusion. And the fourth compound is eribulin. Eribulin is not related to Vinca alkaloid, but its mechanism is very similar to Vinca alkaloid. So these are four different examples in these natural compounds. Now you see, now let me explain about vinblastine. Are you all following me, everybody? Are you all following me? Yes? Am I audible to you all? Yes, yes. Okay, okay, okay. Now let us understand about wind blasting. So wind blasting is one of the example of Vinca alkaloids. Always remember when wind blasting is given. Always remember when wind blasting is given, it is not given in subcutaneous route. Very very important point. Just now I told. When if unfortunately if it is leaked, see for example this is a blood vessel. Most of the time these Vinca alkaloids are injected through IV route, right? Okay, they are given through IV route. During injection, if the drug is just spilled outside, if it is spilled outside due to phlebitis or due to puncture of the blood vessel, due to puncture of the blood vessel, or unfortunately due to wrong administration, if it is injected just outside the blood vessel, it will form very very important adverse drug reaction. That is, it will cause ulceration. This is very important precaution we have to take while injecting wind blasting. One important point: they should not be given in subcutaneous. This is very important point for clinical pharmacists. Clear, everybody. Now you see, it is always given in IV route only. This is another important point you have to remember. And one more point: wind blasting is always used either alone or it can be given in combination. It can be given in combination with. It is given in combination with bleomycin. It is given along with bleomycin. It is given along with cisplatin. About this bleomycin and cisplatin, I'll explain. Okay, these drugs will come again in the upcoming lectures. Okay, and this combination, particularly bleomycin and cisplatin, along with windblastin, this combination is given particularly in metastatic testicular cancer. I mean, testicular cancers. Metastatic testicular cancer. In this condition, this combination is very very commonly used. This is very important, very important point you have to remember. And another very important point, always remember, vinblastine is the component of ABVD regimen. It is the important component of AB. About all these regimens, I will try to explain you. We have different regimens. ABVD is one of the regimen. In that, vinblastine is one of the example. Okay, so those are a few examples. Yeah, just now I explained you. Vinblastine is used with bleomycin and cisplatin, particularly in metastatic testicular cancer. And nowadays, vinblastine is replaced with etoposide. Prajwal, are you there? Prajwal, are you there? Prajwal. Yes, Prajwal. Recently, you have written a review article on etoposide, right? So nowadays, actually, vinblastine in previous days, vinblastine was used in combination with bleomycin and cisplatin for testicular cancers. But nowadays, what due to its adverse effects, I'll explain the adverse effects of vinblastine. Due to its adverse effects and some bad effects, vinblastine is nowadays it is replaced with etoposide. Etoposide, about this etoposide also we'll discuss. Okay, so this is another important drug. I think Prajwal has written review article. If that article, if you have, you can just share into the group. People will read about this article. Okay, and it is important component of ABVD regimen. Just now I explained, and ABVD regimen is particularly given for Hodgkin's lymphoma. About this Hodgkin's lymphoma, tomorrow we'll try to discuss, and about this ABVD regimen, tomorrow we'll discuss in detail. And along with that, Kaposi sarcoma, neuroblastoma, Langerhans cell histiocytosis, bladder cancer, breast cancer, and choriocarcinoma. All these conditions we'll discuss in upcoming classes. Okay, so vinblastine is important drug which is used in these following conditions. Remember all this about all these cancer conditions. Again, vinblastine will come at that time. It is not important for us to read all the pharmacological concepts. That's why we are discussing now. Okay, vinblastine is never used in subcutaneous route. It is not given in IM route. It is given only through IV route. If it is given through subcutaneous or IM, it will cause ulcers. It will cause ulcers. These are important points you have to remember always. It is always given in combination with bleomycin or cisplatin, particularly for testis cancer. This is another important point you have to remember. And vinblastine is another important component of ABVD regimen. These are important points you should never forget. Now, just now I told ABVD regimen. In ABVD regimen, we have adriamycin, bleomycin, vinblastine, and dacarbazine. All these drugs and regimens we discuss about when we discuss about Hodgkin's lymphoma. At that time, I'll try to explain this regimen. Okay, so it is important component of ABVD regimen. Now you see, let us try to understand the adverse drug reactions of vinblastine. This slide is very very important. You all understood that vinblastine is used in Hodgkin's lymphoma, it is used in breast cancer, it is used in testicular cancer, it is used in bladder cancer. Most of the cancers already we have discussed. When this vinblastine is used in these many types of cancers, this vinblastine, what it does, it may have certain adverse effects. First important point, just in mechanism I told you, always remember Vinca alkaloids. Vinca alkaloids are stopping the cell division, right? They are stopping the cell division. Cell division. When cell division is stopped, this cell division is not only stopped in neoplastic drugs, neoplastic cells. They are not only stopping cell division in neoplastic cells, but also they are stopping cell division in normal cells. In which normal cells? The normal cells which are continuously dividing, continuously dividing cells where they are available, continuously dividing cells are available in hair follicle. They are available in GI tract, in GI epithelium. They are available in bone marrow. They are available in testes. They are available in ovaries. Okay, all these different tissues, always cell will be dividing, continuous cell division will be seen in those particular tissues. So Vinca alkaloids, what they will do, they will stop cell division in hair follicles and they will cause alopecia. Alopecia, actually this alopecia is reversible, reversible alopecia. Vinca alkaloids will cause alopecia. Vinblastine, vincristin, particularly vinblastine, not only vinblastine, vincristin also, they will cause reversible alopecia. When the drug administration is stopped, hair follicles again they will start development. Again cell division will start, and again alopecia will be stopped, and hair growth can be seen. Okay, that's why alopecia is reversible always. One adverse effect. Second adverse effect, it will stop the cell division in GI tract, starting from the esophagus, stomach, duodenum, small intestines, and large intestines. In all these particular linings of this GI tract, epithelial tissue is not developed. Due to that, what it causes? It causes constipation. In the urinary bladder, it causes urinary retention, and in GI tract, it causes GI upset, sometimes abdominal pain also due to constipation. So constipation is another very important adverse effect with Vinca alkaloids. It is seen with vincristin also. Okay, this is another common adverse effect. And another very, very important adverse effect with vinblastine is it will cause bone marrow suppression. Why? Because vinblastine is stopping the cell division in bone marrow. Because in bone marrow we have stem cells. In stem cells, continuous cell division, continuous differentiation will be seen. The bone marrows will produce myeloid. What we have? We have myeloblast. We have lymphoblast. Myeloblast again differentiates into neutrophils, eosinophils, basophils. Always cell will be dividing. So when vinblastine is given, it will stop division of cell in the bone marrow. That's why it will cause bone marrow suppression. With that, what it does, when bone marrow suppression is done, it will stop production of RBC. RBC cell decreases, WBC cell decreases. It will cause pancytopenia. Simple. Due to bone marrow suppression, what it causes? It causes pancytopenia. So this is another important adverse effect with vinblastine. Pancytopenia से anemia होगा. With anemia, infection risk will increase. All those adverse effects we can suspect with vinblastine. And another very, very important. This is another important. It will cause neurotoxicity. Very, very important adverse effect with vinblastine. Vinblastine and vincristin, both the drugs, what they cause? They will cause neurotoxicity. They will cause peripheral neuropathy. The peripheral areas, for example, if you just imagine this is hand, okay, hand fingers, fingers here at the peripheral areas, the nerves will be damaged. The nerves will be damaged, and with that it causes peripheral peripheral neuropathy, very dangerous adverse effect. That's why other than this, see in brain also, in brain, one very important point I would like to add here. All remember, everybody, always try to remember, concentrate everybody. In the brain is continuously requires microtubules for its normal physiology or for formation or whatever may be. To perform its normal actions in the brain, microtubules are very much required. What vincristin and vinblastine are doing? Vincristin and vinblastine are decreasing the formation of microtubules. When microtubule formation is decreased in the brain, again what it does, it causes neuropathy or CNS related disorder, CNS related symptoms. And here, when microtubule synthesis is stopped in the brain, what happens? CNS symptoms, like it will cause coma, it will cause convulsions. Okay, it will cause severe headache. All these are adverse effects which are associated with CNS system. In CNS system, vincristin and vinblastine are severely neurotoxic. They are neurotoxic. That's why always remember Vinca alkaloids. Vinca alkaloids are never ever administered through intrathecal route. Intrathecal route means the drug is administered directly into the spinal cord. It is directly administered into the cerebrospinal fluid. The drug is administered directly into the cerebrospinal fluid is intrathecal route. If it is administered into the cerebrospinal fluid, what will happen? It will go into the brain. It will decrease the formation of microtubules in the nerves, and it will cause central nervous system and also peripheral nervous system adverse effects, and it will cause neuropathy. Okay, so these are very important adverse effects you should never forget about Vinca alkaloids and vincristin and vinblastin. Clear everybody till here? Clear everybody? Now I would like to tell you important points about. I have not finished about vinblastin. If you see the pharmacokinetics pharmacokinetics of Vinca alkaloids or vinblastin pharmacokinetics, if you see the ADME, once the Vinca alkaloids are administered, they are they are distributed in most of the tissues. Okay, they are distributed in tissues, and most of the drug is metabolized by cytochrome P450 enzymes. Cytochrome P450 enzymes. In the liver, most of the drug is metabolized. And actually, most of the drug is approximately 80 to 85% of drug is metabolized in the body, and it is excreted through bile. The metabolites are excreted through bile. They are excreted through feces. याद रख लो. They are excreted through liver, and only 15% or less than or equal to 15% of Vinca alkaloids, especially vinblastin, is excreted through urine in unchanged form. Actually, these Vinca alkaloids are highly water soluble. They are water soluble. That's why they are excreted through urine in unchanged form. But only 15% is excreted through unchanged form, and remaining 80 to 85% is easily metabolized by the body, and they are excreted through bile. Now you see, when a patient is having hepatitis, or if a patient is having hepatic failure, in that cases, always remember Vinca alkaloids doses should be restricted. 70 to 80% of drug is decreased in patients who are already having hepatitis or hepatic failure. Why? Because drug is excreted through liver. Drug is excreted through liver. That's why its dose is decreased in the patient who is having hepatitis. Clear everybody? Clear everybody? These are important, very important points about vinblastin and Vinca alkaloids. Now let us talk about vincristin. Let's talk about vincristin. Always remember vincristin and vinblastin or Vinca alkaloids. They are having same mechanism of action. They are having same pharmacokinetic action. But one thing you have to remember: the difference between vinblastin and vincristin. There is only single difference. There is single difference. Vincristin has more neurotoxicity. Neurotoxicity. And vinblastin has more bone marrow suppression action. Vincristin has more neurotoxicity. It shows more neurotoxicity, and vinblastin will show more bone marrow suppression. Other than these two differences, remaining all concepts are very similar with vincristin and vinblastin. Clear? Now, another important points about vincristin, let me tell you. Already in the group, I already explained you vincristin should never be given in intrathecal route. And another important point, in previous classes, I already told there is one regimen called CHOP. There is one regimen called CHOP. In that regimen, vincristin is one of the compounds. In CHOP regimen, this regimen we'll try to discuss one day. Okay. In CHOP, actually C indicates cyclophosphamide, phosphomide, and H indicates hydroxy, hydroxy, donorubicin. This is antibiotic, anti-cancer antibiotic. O indicates oncovin, oncovin. Oncovin is the brand name, and its generic name is vincristin. CHO and P indicates prednisolone. So this is the very important regimen for certain myelomas, and in few what we say in leukemias. In leukemias, this CHOP is very important. So in CHOP regimen, vincristin is important. component. This is another important point you have to remember about vincristine. Vincristine has very high neurotoxic ability. That's why it is not injected in intrathecal route. It is the component of CHOP. Okay, and if you see the doses of vincristine, always it is advised as 2 mg per meter square, and it is administered once weekly. Once weekly. This is important point about vincristine. Another very important point about vincristine. Always remember, most of the children can tolerate vincristine. Children can tolerate vincristine, whereas adults can't tolerate vincristine. Very important point. That's why vincristine is very commonly used in leukemias in children. In children, patient who is suffering with leukemias, vincristine is always drug of choice. It is very important drug which is given in small children. And one more point, already I told you, vincristine has less bone marrow suppression action, whereas vinblastine has more bone marrow suppression action. That is one important point you have to remember. And same like other Vinca alkaloids, it also has constipation as adverse effect, and it also has alopecia because mechanism of action with vincristine and vinblastine both are same. Okay, so for vincristine, 2 mg per meter square once weekly it is given. It is very commonly used for leukemia in the children because most children will be having toleration ability, and adults can't tolerate vincristine doses. Okay, and it has less bone marrow suppression action, and it has more neurotoxic activity. That's why it is not given in intrathecal route. And constipation and alopecia are very similar with vincristine and vinblastine. Okay, so these are important points you have to remember about Vinca alkaloids, vincristine and vinblastine. And always remember, on the vincristine and vinblastine, it is always written with the red or blue line, blue highlight. It is written, it is never injected in intrathecal route. It is never injected in intrathecal route because it causes neuropathy, it causes uncontrolled convulsions. Uncontrolled convulsions can be seen, and patient will go to coma. Very lethal adverse effect with Vinca alkaloids. With Vinca alkaloids, these are important points you have to remember. I think these points are clear to you. And the next drug which is very similar to Vinca alkaloids is vinorelbine. Vinorelbine. So for this drug, there are very few important points always you have to remember. It is used in lung and breast cancer. Its mechanism of action is very similar to Vinca alkaloids. Vinca alkaloids. And always remember, see, it is given with dilution. It is already written, must be diluted. It is always diluted in NS. It is diluted in NS, and this diluted vinorelbine compound is infused. It is infused at least 5 minutes, 5 to 10 minutes. At least 5 minutes we should take time to infuse. Rapid bolus infusion is always contraindicated with vinorelbine. Why? Because it will cause lethal adverse effects. Particularly, it will cause uh, hypersensitivity reactions. Hypersensitivity reactions, and it is very irritating. Irritative, and it is cytotoxic. Or like all other anti-cancer drugs, it is cytotoxic. And common dose is 30 mg per meter square is common dose, and it is given every week. Every weekly once dose is given with vinorelbine. Okay, and if you see the adverse effects of vinorelbine, always remember, vinorelbine adverse effects are limited with Vinca alkaloids. Vinca alkaloid adverse effects से कम है. For vinorelbine, adverse effects are very less when compared with vincristine and vinblastine. But there are other adverse effects which are common with vinorelbine. One is allergic reaction. Just now I told, that's why it is very slowly given, allergic reactions. And it causes granulocytopenia. Only particularly granulocytes will be decreased in the body, like neutrophils, eosinophils, basophils. Okay, this particular cells will be decreased in the body, and it may actually it is metabolized by the liver mainly. That's why if a patient is having liver failure, in that conditions, its dose should be decreased. Same like vincristine and vinblastine. Okay, so these are important points you should remember about vinorelbine. What important points we have seen? Vinorelbine, 30 mg per meter square. It is commonly used for lung and breast cancer. It is compulsory diluted in normal saline, and it is infused more than 5 minutes, 5 to 10 minutes. It is not given in IV bolus. If it is given in IV bolus, it causes anaphylactic shock or severe allergic reactions because it is highly irritating. Okay, so 30 mg per meter square it is given every once weekly. These are important points about vinorelbine, and adverse effects are very less when compared with vincristine and vinblastine. These are important points about vinorelbine. Now, next important compound which is related to vincristine and vinblastine. They are not Vinca alkaloids. Okay, this is not eribulin. Eribulin. This drug is not Vinca alkaloid, but it is a naturally occurring compound. It is a naturally occurring compound. Always remember, eribulin is obtained. It is obtained from helicondrin. You know, this compound is called helicondrin. Helicondrin is the macromolecule, macrolide. It is a macrolide. It is a macrolide which is obtained from the sponge. It is obtained from algae. You know, this is algae. It is the algae which is grown in Pacific region, which is called Helichondria ocadi. Helichondria ocadi is the sponge. It is the Pacific marine sponge. Pacific marine sponge. From this plant, actually, it is a living organism. From this plant, we started developing, or we extracted helicondrin. Helicondrin is the raw molecule, and from this helicondrin, we extracted eribulin. So eribulin is the analog of helicondrin, which is obtained from the Pacific marine sponge of this animal, of this particular plant. This is algae. No, algae means plant only. No, it is. Uh, uh, I think yeah, algae is not a plant and not a animal. Okay, that is one of the organisms. Anyways, chalo. So from this algae, helicondrin is obtained, and from this helicondrin, we extracted eribulin. Eribulin is the analog of helicondrin. That you have to remember. Clear, everybody? Now let us try to see some important points about eribulin. See, eribulin among the natural compounds, eribulin is resistant to PGP. Very, very important points. Eribulin is resistant to PGP. If a person is already expressed with P glycoprotein in their cell, if the person is already expressed with P glycoprotein, when natural compounds like vincristine, vinblastine, these Vinca alkaloids are given, what will happen? These Vinca alkaloids are easily excreted out, and Vinca alkaloids are having probability of showing resistance, right? So here, eribulin is resistant to PGP. So PGP expression can't do anything for this eribulin. That's why if a patient who is having Vinca alkaloid resistance, who is expressed with PGP, in those cases, eribulin is drug of choice. Eribulin is drug of choice to the patient who is having expressed with PGP or MDR, 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 MDRD1. Okay, multi-drug MDR1. So it is in that particular patients, eribulin is drug of choice. Clear this important point? Understood, everybody? That's why it is very, very commonly used in the patients who are having Vinca alkaloid resistance, particularly in the patients who are suffering with metastatic breast cancer. Okay, who are having bladder cancer, who are having other cancers which are related to Vinca alkaloids. In Vinca alkaloids, wherever Vinca are given, in that conditions, eribulin is drug of choice because of this major unique point. This is unique feature of eribulin. Okay, and if you see some adverse effects for eribulin, also we have some adverse effects. For this eribulin, we have, it causes neutropenia, it causes neuropathy, and same like other Vinca it also causes GI toxicity. So these are important adverse effects of eribulin, and no alopecia, no other symptoms are seen with eribulin. So eribulin is one of the boon. It is extracted naturally from the Pacific sources of Helichondria ocadi species, marine sponges. Okay, from the sponges it is obtained. Sponges, I think they are algae only, no? All sponges are algae only, no? They are type of algae, right? I don't know about all those things, but you remember they are obtained from the sponges, which is Helichondria ocadi species. Okay, so this is important point about eribulin. I think we have covered Vinca alkaloids. Vinca alkaloids के बारे में कुछ doubt है तो you just tell me. And now we'll try to discuss about Taxanes. Just let me take short break. See, in cell specific neoplastic drugs, in cell specific drugs, we have many drugs in that Vinca alkaloids, and we have Taxanes. Actually, what Vinca alkaloid does, Vinca alkaloids are stopping the production of microtubules, and with that, it is stopping the cell division, and with that, it is stopping the cell division of neoplastic cell, and it is killing the neoplastic cell. Through that, Vinca alkaloids are having their mechanism. But see, taxanes are also the drugs which are acting on microtubules only. They are also having same action, but here you see their action is slightly different. See, when cell is dividing in metaphase, when the sister chromatins are formed here like this, sister chromatins are dragged at one direction by the microtubule. These microtubules are dragging at one direction, right? They are contracting these sister chromatins to this direction, and this contraction was done by microtubules. Actually, this microtubule formation is seen in previous stage only, in prophase. In prophase, that is seen. In metaphase, this dragging is seen. After metaphase, what happens? Again, these microtubules which is formed, these microtubules should dissociate. They should dissociate into alpha and beta, all small molecules. They should be dissociated. Here, taxanes, what they do, taxanes always, once the microtubules are formed, what they will do, they will enhance the formation of microtubule. That means, in simple way, if we say, they will enhance the polymerization. Once the polymerization of this microtubule is done, it will not again dissociate into alpha and beta globulins. I mean, alpha beta molecules of these tubulins. Okay, microtubules. So these microtubules are polymerized, and they will same like when cement is done to the product, what will happen? It will be forming one polymer. So it will permanently form the polymer of the microtubules and stops the depolymerization of this microtubule. Microtubule depolymerization will not be seen. Mechanism is slightly different, but they are acting on cell cycle only, cell division only. In cell division only they are acting. Taxanes, what they are doing, taxanes are forming polymers of microtubule खाली भी microtubule polymer हो जाता, form हो जाता, and this microtubule polymers will not again dissociate. Okay, depolymerization is not seen. That's why cell division further will not be proceeded. That's why it will cause stoppage of cell division. Okay, simple point. Taxanes will enhance the polymerization of microtubules. They will enhance the polymerization of microtubules, and by that it will stop the depolymerization of microtubules, and with that cell division will be stopped. Simple. Okay, mechanism is that. Yes, sir, upon just for understanding purpose I am telling. Vinca alkaloids and taxanes, simply what they are doing, they are stopping cell division. Simple, you remember this, that is enough. Now, in taxanes, if you see, in taxanes, the first compound which is isolated is paclitaxel. This is very, very important compound. I'll try to explain you the important points about this paclitaxel. And this paclitaxel is obtained from the bark of a tree. So this is the a tree. From this bark it is obtained. This is the fruit and leaf of the a tree. Okay, and after paclitaxel, there are some more semi-synthetic compounds are obtained. They are synthesized, which is docetaxel and carbazitaxel. So docetaxel and carbazitaxel are newer drugs. They are newer drugs. However, these newer drugs are synthesized. Paclitaxel is still used nowadays. Paclitaxel is still used, even though newer compounds are obtained from this paclitaxel, because they are having unique pharmacological properties. Now you see, this is the formulation of paclitaxel, which is available in IV form again, and docetaxel, and we have carbazitaxel. See, for paclitaxel, always remember, for paclitaxel is not water soluble. It is not water soluble. So this is not available in powder form. It is not available in powder form. Actually, it is obtained in powder form, but in hospitals it is not available in powder form. Why? It is available only in solution form. If even if it is available in powder form, we have to dissolve it. To dissolve, what happens? Paclitaxel is always dissolved with 50% ethanol, and 50% it is 50% it is dissolved with castor oil. Okay, castor oil. So to dissolve paclitaxel, always it is dissolved in 50% ethanol and 50% castor oil, and that solution is again diluted and that is infused into the body. Okay, so that is important point you have to remember about paclitaxel. Now let me talk about important points about paclitaxel. I think we understood the mechanism of action of taxanes. Mechanism of action of toxins, what it does, it will stop it will stop deep polymerization. Once polymer is formed, once it is acting like a cement, it is stiffing the microtubule. Once polymer is formed, it will stop depolymerization, and with that it will stop cell division. This is the mechanism of action of taxanes, particularly paclitaxel. Okay, now these taxanes are very commonly used for solid tumors, and they are used for ovarian. याद रख लो यहाँ पे paclitaxel and taxanes are used in ovarian cancer. They are used in breast cancer. They are used in gastroesophageal cancer. They are used in prostate cancer. They are used in bladder cancer. Prostate, which is related to genital; breast, which is related to genital; ovary, which is related to genital. Okay, so they are particularly taxanes are particularly used for breast cancer, ovarian cancer, gastroesophageal, throat cancer, prostate cancer, and bladder cancer. Okay, so these are important tissues you have to remember for taxanes. These are important for these solid tumors. Okay, and now let me tell you about the pharmacokinetics, ADME of these taxanes. See, just now I told paclitaxel is not soluble in water, right? So to dissolve that in water, always it is mixed with 50% ethanol and 50% polyethoxylated castor oil. Polyethoxylated बोलते हैं castor oil. Just remember castor oil. And very important point you have to remember. If you see the metabolism, everybody should concentrate here. Everybody should concentrate here. Very important concept about taxanes. About taxanes. Till now, it has not come for. We have discussed Vinca alkaloids and we have discussed about alkylating agents, right? In these compounds, this term, this important point has not come. See, for taxanes, the drug is metabolized in liver. The drug is metabolized in liver, and the metabolic waste products are excreted through urine, and few are excreted through feces. Here, the taxanes are metabolized by cytochrome P450 enzymes. Okay, when taxanes are given along with enzyme inducer, when taxanes are given along with enzyme inducers, what will happen? Enzymes, the cytochrome P450 enzymes will be induced, and it will stop the actions, or it will fail the actions of taxanes. So in enzyme inducers, can anyone tell me the examples of enzyme inducers? Always remember about enzyme inducers. There is one simple mnemonic always I explain to my students. Very good, very good. CRAP GPS, CRAP, CRAP GPS. CRAP in the GPS, induced headache. Induced headache. When we take GPS maps and we travel, no, while traveling, if anything crap is seen on the road, what will happen? GPS में changes हो जाएगा. So crap in GPS will induce headache. Like that you have to remember. So here crap GPS is very important mnemonic. C indicates carbamazepine. Carbamazepine. R indicates rifampicin. A alcohol. P phenytoin. G graciofulvin. P again another P, phenobarbital or phenobarbital, and S indicates sulfonylurea. Sulfonylurea. Sulfonylurea is glibenclamide. All oral antidiabetic drugs will come under enzyme inducers. See, carbamazepine, antiepileptic drug; rifampicin, antitubercular drug; alcohol, phenytoin, graciofulvin. Phenytoin is again anti-epileptic drug, graciofulvin antifungal. Anyways, graciofulvin अपन use नहीं करते हॉस्पिटल में. Very toxic drug it is. We will not use. phenobarbital, again sedative, and benzodiazepine and anti-epileptic drug. And sulfonylureas are very, very commonly used. Here you have to remember, particularly first generation sulfonylureas. So when taxanes are used along with these crab GPS drugs are enzyme inducers. When these drugs are given along with taxanes, they will induce cytochrome P450 enzymes, and immediately all the taxanes will be metabolized rapidly. And due to rapid metabolism of taxanes, it will stop the actions, it will stop the anti-neoplastic actions. So when taxanes are used, always avoid enzyme inducers. If enzyme inducer is compulsory, if it is indicated, in that cases, taxane doses should be monitored. Doses should be increased in the patient. Dose increase करके देना है taxanes. Understood this important point about taxanes? Till now, see, most of the anti-cancer drugs are always keenly monitored with enzyme inducers and enzyme inhibitors. It is not for Vinca alkaloids and not for alkylating agents. Particularly for taxanes, we have to remember this point. And in the same way, like enzyme inducers, we have enzyme enzyme inhibitors. These enzyme inhibitors, what they do, these enzyme inhibitors will decrease the enzymes in the liver. Cytochrome P450 enzymes will be decreased in the body, and with that, if taxanes are given, taxane concentration increases and it will cause toxicity. So enzyme inhibitors also should be keenly monitored. So in this case, enzyme inhibitors examples are, can anyone tell me the examples of enzyme inhibitors? A sickfaces.com group. Always remember, sickfaces.com group is the mnemonic for enzyme inhibitors. Sickfaces.com is the mnemonic for enzyme inhibitors. S indicates sodium valproate. I indicates isoniazid. C cimetidine. K ketoconazole. F fluconazole. A again alcohol. C ciprofloxacin. E erythromycin. S, here we have sulfonamides. Not sulfonylurea. Sulfonylurea will come in enzyme inducers. And again, C indicates one C is cimetidine, C ciprofloxacin, and this is chloramphenicol. Anyways, chloramphenicol अपन use नहीं करते, which is very, very strong enzyme inhibitor. And O, omeprazole, and M, metronidazole. Always remember, sickfaces.com group. G here is grapefruit juice. Okay, sickfaces.com group is the enzyme inhibitory group. When these drugs are given, all the cytochrome P450 enzymes will be inhibited, they will be decreased. And along with this, if certain drugs, narrow therapeutic drugs like taxanes are given, if oral contraceptives, not oral contraceptives, here if warfarin is given, warfarin toxicity can be seen, taxanes toxicity can be seen. Okay, phenytoin the phenytoin toxicity can be seen, like that. So many drugs toxicity can be seen if sickfaces.com enzyme inhibitors are given along with certain narrow therapeutic drugs. So again, let me repeat. S stand for sodium valproate, I isoniazid, C cimetidine, ketoconazole, fluconazole, alcohol, ciprofloxacin, erythromycin, sulfonamides, here chloramphenicol, omeprazole, and metronidazole. So these drugs are all enzyme inhibitors. याद रख लेना. They will inhibit the enzymes in the liver, and with that, toxicity of certain other drugs will be seen because they will not be metabolized, because all the enzymes are inhibited. Clear? So about taxanes, always remember the drug interaction with enzyme inducers and enzyme inhibitors. Now let us see about the adverse drug reactions of taxanes. Right, adverse drug reactions of taxanes. Always remember, taxanes are also showing they are decreasing the cell division, right? So they also causes alopecia, same like Vinca alkaloids. Okay, and they causes myelosuppression means bone marrow suppression, because in bone marrow all the cells are dividing rapidly. So rapid division cells are decreased because these are decreasing the cell division. Okay, alopecia, myelosuppression, and neurotoxicity, same like vinblastine, neurotoxicity, and it causes hypersensitive reactions. All taxanes will show hypersensitive reactions. And always remember, when these drugs are used in the patient, always we have to dilute and use. and slowly they are used in intravenous infusion, IV infusion. Okay, so these are important points about taxanes. I think we have covered all the important points about Vinca alkaloids and taxanes. Paclitaxel, always remember, paclitaxel is obtained from the bark of pear tree. Okay, docetaxel and carbazitaxel are newer drugs, and their formulations we have seen. And yeah, enzyme inducers and enzyme inhibitors, always remember. And for Vinca alkaloids and other natural compounds, remember, I think we have already discussed all these important points. Okay. So with this, few natural compounds are done. Actually, natural components, again, few other antineoplastic drugs are there. In natural compounds, only two are done. One is Vinca alkaloids and taxanes. Two are done. And with this, now Vinca alkaloids were done. That's why in next class I will explain you about lymphomas. Lymphoma is very very important concept. In that we have Hodgkin's lymphoma and non-Hodgkin's lymphoma. That we'll discuss in tomorrow's class. Okay. With this, I'll stop today's class. इसमें किसी को डाउट है तो पूछो अभी.